May 7th is International Harm Reduction Day. And through this week-long Lunch and Learn webinar series, we hope to provide education, direction, and resources on best harm reduction practices and supports in Central Alberta, as well as a greater insight for how we support healthier, safer communities for all. This is our first Lunch and Learn, so thanks for joining. On our topic today is going to be rural outreach and its impact on harm reduction. The webinar today will be roughly about 15 to 20 minutes long, followed by a quick question period. Please feel free to ask any of your questions in the Q&A chat box throughout the presentation, and our presenters will try and do their best to answer the questions at the end if there are any.
Thank you, Mitch. My name is Kevin Cunningham, and I do rural outreach for Turning Point in the Central West Zone of Alberta. So the first slide here shows our vision, which is respect and dignity for all in a safe and healthy community. And there's a list of our programs and services, and I'll briefly go over the programs and services we offer. And the one at the top of the list there is our largest program, which is our harm reduction program. That sees over 2,200 people, unique individuals. And that program is access to needle, syringe, substance use equipment like pipes, straight shooters, also safer sex supplies, so condom, lube, dental dam. And our harm reduction workers also look after around 25 needle disposal boxes throughout the downtown Red Deer and parks and trail systems. That is by far our busiest program, and that program has numerous harm reduction workers who work the front lines and really distribute supplies. But the main core of what we do is build trust and relationships with people, because people who use drugs are some of the hardest to connect with, and those workers build relationships so that when people come in and see us and get to know us and then have some deeper questions to ask about their health, then they feel comfortable asking our harm reduction workers where to access detox or treatment or health services. So that's our largest program. The next program I'll mention is our women's program. And just a shout out right now, our women's program is looking for a part-time person. So if you're interested, please reach out on our website. And our women's program was inspired by the HER pregnancy program, Streetworks in Edmonton. That stands for Healthy, Empowered, Resilient. And it's staffed by a nurse and an outreach worker who work to address substance use, poverty, domestic violence, and the focus is on sexual and reproductive health. The next program I'll mention is rural outreach, which we'll get into a little more as the presentation progresses. Health promotion is the roots of our agency and is staffed by myself, who works with people who are living with HIV, hepatitis C, and other STIs. And really, I work to connect people to health and social services and stay connected to healthcare through that program. Nightreach is staffed by a couple of outreach workers who walk the downtown parks and trail systems 365 evenings per year in downtown Red Deer. And those night reachers are out there connecting people also to health and social services, walking people to the shelter, and just providing first aid and wound care, whatever people need out there on the streets. Overdose prevention is, we have an overdose prevention site in downtown Red Deer, and we also have an overdose prevention program, which is staffed by a nurse and an outreach worker who distribute naloxone, do naloxone trainings to other agencies and to the community in general. Giving Back is a really interesting program where we have a few of our clients come in for a couple hours, and we walk around downtown Red Deer or throughout all of Red Deer and tidy up needle debris. And that's a really great program that's running right now. And then the last program I'll mention is the CAMEL program, Central Alberta Men's Outreach. And that's all things sexual health related for men. And yeah, that's our programs and services. Next slide.
Hi, everyone. Thank you for joining us today. My name is Jen McCrindle, and I do harm reduction outreach to the east of Red Deer. I'm going to talk to you a little bit about what exactly is rural outreach and how do we work. So rural outreach makes most of those services available on a smaller scale to towns in the central zone around Red Deer. Our program is funded by the generosity of the United Way. With their support, we are able to travel to connect with people using substances, educate on safer using practices, distribute harm reduction supplies, and assist them with accessing resources in their communities. This can include things like income and food security, housing, domestic violence shelters, prescription coverage issues, medical care for abscesses or other health concerns, excuse me, and finding pathways to treatment services, including opioid replacements such as Suboxone or methadone. We strive to meet people wherever they are at, which includes being in active use, at risk of relapse, or seeking recovery. Our work is done with a harm reduction approach of respect, dignity, compassion, and evidence-based healthcare interventions. We also work to build capacity within small communities to offer support to organizations, businesses, and decision makers in the midst of a prolonged drug poisoning crisis. We appreciate the opportunities we have had to present on drug trends and stigma and naloxone training in a very diverse range of interest groups. Groups recently have included Citizens on Patrol, a security company, grades 6 to 12, including teachers, staff, and parents in a school setting, community support work students, fundraisers, children and family services, learning centers, and several rural businesses. Presentations and discussion can be held in person, ideally outside as social distancing and COVID precautions allow, or we can host something on Zoom if that works better. It is important to keep the conversations on these issues going and be collaborative in our efforts to address substance use. Rural Outreach is able to train businesses and small communities on overdose response and how to pick up any sharps should they be found on someone's property. It doesn't happen frequently to cause alarm, but it is also not uncommon for needles to be found in parking lots, campsites, or parks, store washrooms, for example. We can educate staff on how to pick up and dispose, educate on actual versus perceived risk, and what to do if accidentally stuck. Creating a healthier and safer community is our goal with education and preparedness to these kinds of situations rather than compounding to the stigma of drug users. One of our strengths is that we are low barrier and informal to access. There is no specific criteria for someone to meet. We will work with anyone in need of harm reduction or education. Because we are mobile, we can meet with people in more comfortable environments than an office building at a scheduled time, for example. We definitely take referrals from other organizations, but anyone can access rural outreach by phone, text, Facebook, email, whatever works. It is important to note that we try to involve and include as many voices of people living through this crisis as possible in our work. We have requests for varying volunteer opportunities and do our best to make that happen, but it can be difficult to provide those in small places when privacy is a concern and people hesitate to be outed as using substances. We have encouraged and supported people who use drugs to speak at and attend events and to participate in things like housing surveys, committees, and meetings held in their communities. The people that policies and decisions affect should be consulted in the planning and implementation stages. People are very capable and willing to share their experiences and what their needs are. Communities everywhere can do more to listen and include these perspectives in their programming and supports. Nothing about us without us is a guiding principle of our peer work and outreach.
So the next slide shows why is rural outreach needed? So something I've noticed in working in smaller communities is that, like Jen said, there is a privacy concern, and it seems like the more closely knit a community is, there's more opportunities for people who need to access supplies, accessing supplies from a family member, a friend. And because drug use is still so highly stigmatized, a lot of people in rural communities are driving their substance use underground, or they don't want everybody to know their business. So that combined with less access points in rural communities is really challenging for people accessing these services. So a lot of the outreach happens over the phone, online, any way someone can connect with us through email. And then one part of the program is that we mail supplies out to people. so long as they have a safe address to receive them at. So the slide here shows what a brand new needle looks like every single time it's used. So a brand new one is quite sharp there on the top. And then just use once, you can see it starts to become jagged. And then used 6 times, it looks really, really quite haggard. And so one individual I was working with in a small community before connecting to rural outreach was reusing the same syringe, sometimes for up to a month. And some of the practices without needle syringe programs are sharpening that needle tip on the end of a matchbook. And this person hadn't been using new needles and was getting 3 to 4 site infections per year. And one of the site infections actually landed them in the ICU for a week and near death. So since connecting with rural outreach, this person is able to access new supplies every time. And as any medical professional in phlebotomy is trained, once that needle tip enters and pierces the skin, if it's pulled out again, then a new needle tip should be used, as you can see on that picture. So that's just the bare bones of why harm reduction is important. It leads to far better health outcomes for people who access the program. And in its absence, we see things like HIV, hepatitis C go way up in areas where harm reduction supplies are harder to access. So that's the why rural outreach is needed. And that's just for the clients accessing our program. Something Jen mentioned also too is community capacity building. And we are able to go out into community and educate on stigma reduction and train people on harm reduction practices, and also open up satellite sites. And satellite sites is a network of pharmacies, other social service agencies, and peer networks that distribute supplies on behalf of Turning Point within the local community. Recently, a satellite site was opened up in Sundre. We have satellite sites in Rocky Mountain House, spread throughout all the Central Zone. And we are always looking to train the staff of satellite sites and open up satellite sites where there are no access points in the community. So that's why rural outreach is needed. Creating more informed communities and reducing stigma. Yeah, next slide. The where and when, our program is covers a massive zone. As you can see on the photo there, that's the Central Alberta zone, the AHS Central Zone. So on the west side, I go all the way up to Drayton Valley, as far north as Drayton Valley, and as far down south as Didsbury and Sundre. All the way west out to Rocky Mountain House, Lacombe, Ponoka, Black Falls. And then Jen covers the Central East Zone, so all the way out to Consort, Coronation, Stettler, Killam, Vermilion. It's a massive zone we cover. We make it out to each community as much as possible, but it's more so when we are invited and where we have connections in communities. So we obviously can't be out in every community every day. So it's a by needs basis. And then we do schedule some appointments out in community, and then we will also come when we're requested. And then we also do some proactive work and do cold calls and just get a finger of the pulse on what's happening in a community. A lot of our connections happen by clients coming in from outside communities into Red Deer, into the office, and meeting them that way and building trust. And then understanding that, oh, this person traveled all the way from a small town near Drayton Valley. So then we exchange contact information and stay in contact so that they know they can access the outreach workers anytime and have supplies shipped out through the mail. Next slide. Who we work with. We work with individuals, like I said, through outreach through phone, in person, at community events, or online, and then through the mail. We also work through our satellite sites and refer people who come to the office asking, say, someone comes into the office and says they're from Sundre. Well, we can let them know that the Community Drug Mart has supplies there for them to access as well, or they could connect with the outreach worker and have supplies delivered. We also work with partner organizations like Alberta Health Services, FCSS, and any other social agency in the area, and also businesses too. We've been brought into businesses and schools to do harm reduction training and naloxone. distribution as well.
Okay, so to talk about stigma in rural communities. Okay, sorry. It is felt mostly through the language, I believe, that we hear around us every day. Language has a direct and profound impact on those around us, and it is important to acknowledge that it does. The negative impacts of stigma can be reduced by changing how we talk about substance use, by altering our words to be more respectful and compassionate. These are examples of how seemingly small changes we can all practice making can lead to a broader societal shift in discussing this issue. Firstly, use neutral, medically accurate terminology. Also, if the topic is people who use drugs, avoid using words like addicts, junkies, meth heads or crackheads, or drug abusers. Instead, practice saying people who use drugs, a person with a substance use disorder, or having lived or living experience. Using this people first language puts focus on the individual, not their actions or behaviors. Also, no matter how long someone may be in recovery, do not refer to them as a former drug addict or as clean, or please don't use the phrase clean and sober. The suggestion that someone is clean if they are not using implies that they are dirty or unkept when they are in active use. Instead, say people with lived experience, or simply someone in recovery. The terms clean and dirty could also be applied to the language of workplace or other institutional drug tests. So rather than saying clean or dirty urine sample, say positive or negative for whichever substance you're testing for. Stigmatizing different forms of recovery by implying that it is one drug for another in the case of opioid replacement therapy. These are tested evidence-based treatments that should not be stigmatized for people to access. For service providers, using terminology such as non-compliant or difficult to describe what is likely someone's inability to meet high barriers. I believe that we can support people using drugs even if we are not drug users ourselves. How can we do that? Firstly, don't assume all use is chaotic. Drug use occurs on a continuum from experimental, recreational, and celebratory to problematic and harmful to self or others. It is most often found somewhere in the middle. Understand that everyone's goal is not always abstinence. Periods of abstinence or modified use should be treated as successes rather than failures or not meeting other people's expectations of recovery. For example, if you have someone who is consuming meth by route of inhalation, but has found stability off of opiates or is no longer using needles, we should be celebrating those changes. Any positive change that improves the health or quality of life of people using drugs is significant. Be mindful of comments and conversations online. If you wouldn't say it to someone's face, it is best left off the internet. People who are using see these comments from the community, and it keeps them wanting to remain hidden, using alone, and afraid to access supports. Remind yourself and gently to others that drug users are people with families and friends and are loved. Listen without judgment. It is easy to suggest, but can be challenging to put into practice. Do not disclose those conversations with others unless it is absolutely necessary to do so. Continually check your biases and question content or familiar stereotypes you may see in media or films, TV shows. Learn to recognize an overdose and how to respond with naloxone. Carry it proudly in your vehicle or your bag and normalize talking about it. If you have someone in your life that you love, who you know or suspect is using alone, offer to spot them over the phone as a means of supervised consumption. This is an act of radical love in a time when the illicit drug supply is highly toxic, unregulated, and unpredictable. We do not have access to SCS or overdose prevention sites other than in Red Deer in the Central Zone. There is also a national overdose response line called NORS. It is not ideal logistically for rural cell phones, but it is an option in some. Get involved, whatever that looks like in your capacity and in your community. Plan to attend or organize events, memorials, and opportunities for discussion. Look into joining membership for advocacy groups that align with the principles of harm reduction. Moms Stop the Harm, Change the Face of Addiction, and Aware are some examples of groups that are challenging the stigma around drug use. Thanks.
Thank you, everyone, for your attention. Now we can go to any questions that are coming up.
Yeah, thank you, the both of you, for sharing about the rural outreach work that you do and about stigma and the impacts of that. We have a question here. It says, is safe supply currently available in Alberta? If not, will it be in the future?
There was programs, two programs, one in Edmonton, one in Calgary that began in 2018. Over the last year, the programs had been cut. There was a legal challenge before the courts in which the judge determined that the people that are on safe supply programs, and there's roughly 80 people in Alberta currently, would be allowed to stay on those programs. There's more advocacy needed to be done, as there's no new patients being accepted at this time. But it is a win that the people that were on these programs can remain with the same medications that were provided to them and the same staff that they are familiar with witnessing their consumption. More needs to be done. Yeah, Kevin, did you have anything to add?
I would just like to add that a large majority of people on these safe supply programs that were in jeopardy had a lot of really positive outcomes, like reconnecting with family members, re-entering the workforce, reconnecting to their community. The results were really quite good in any safe supply program that has been implemented around the world, whether it's Switzerland or wherever happens, safe supply programs. I hope that there will be more. And recently I just had there was someone who came from out of province looking to translate their safe supply program to Alberta, and I was not able to help them out. And that person kind of fell through the cracks because there was no programs in Alberta taking new people for programs like that. And when we say safe supply, what we mean is a regulated, quality controlled version of the drug that the person was accessing illicitly. So yeah, that's what I have to say about that.
Great, thank you, both of you. Another question here is, do you have any tips for dealing with Nimby people? That's N-I-M-B-Y, and I believe that stands for not in my backyard. So that'd be people that are opposed to kind of the services that are off at a turning point. So yeah, again, the question is, do you have any tips for dealing with Nimby people? Anybody want to jump on that?
Well, when I'm approached from that perspective is I understand and acknowledge that it's already happening in people's backyard, whether they want to acknowledge it or not. So that's kind of the approach I use as well. If you don't want this in your backyard, it already is in your backyard. And if there are no harm reduction programs available, then there are going to be more discarded needles in public places, and there are going to be not as healthy of a community. So to say like, we don't want these things in our backyard, well, it's already there. We could put this in our backyard and deal with it, or we can pretend like it doesn't exist and hope it just goes away on its own, which usually does not happen. Do you have anything to add, Jen?
I think you covered it. I try to stay focused in the education piece and humanizing people that use drugs, so that they are not seen for actions or behaviors. These are people that are deserving of our love and support. And I think if we can really focus on educating people that may just not be aware of the issues that people face or harm reduction in general, that's how I try to stay focused.
Great, thank you. One other question here. Is there a difference between overdose prevention site versus a safe consumption site?
So an overdose prevention site is just a temporary measure. And that's just put in place like our overdose prevention site in Red Deer. It's in an ATCO trailer, so it's not a permanent solution. There's only 4 booths in this trailer, and sometimes with reduced capacity due to COVID-19, which can drop the capacity down to 2 booths. So as a temporary measure for a city of 100,000 people, 2 booths isn't quite enough. And it is just temporary, where supervised consumption services are a permanent solution, and that offers wraparound services in the facility. So there can be housing intake workers, and there can be mental health professionals, doctors, elders for cultural support. We can bring in and wraparound services inside a permanent location, which is supervised consumption services. I hope that describes the difference. Do you have anything to add, Jen?
No, I think you nailed it. I like to think of overdose prevention sites as only having one job, and that is to bring people back from an overdose or prevent overdoses from happening. Whereas, like you said, Kevin, supervised consumption provides a much more comprehensive and wraparound supports for people that are using, and often lifts them out of active use and into a more stable place in recovery.
Yeah, I can add just a little bit on this topic too. And so I'm someone with lived experience with opioid use disorder and injection drug use. And back when I was out there, 2 things had to be present for me to get into the contemplative state, which is the state when I was considering changing my life, making different decisions. The 2 things that had to be present was, 1, I had just finished using and I was no longer dope sick. And the second thing was I had to be somewhere safe. So a place like an overdose prevention site or supervised consumption services provides those 2 things, where 1, the person can use safely, and 2, there's a post-consumption space where a person can ground out and just sit and relax and get into that contemplative state of thinking the bigger picture stuff.
Okay, there's a few more questions here. I'll move on quickly here. Another one asks, I'm located over in the Strathmore area and was wondering if there is anything set up over in this area or who I could contact to help me with harm reduction in my area.
Strathmore, if I'm correct, is south of Calgary or southeast of Calgary. And so I would say reach out to HIV Community Link in Calgary or SafeWorks and see if they can extend some services out to you in Strathmore.
Yeah, it's just a little bit out of our zone. We do go to Drumheller and Three Hills, but Strathmore is just a smidge south of our borders. But yes, as Kevin said, I would also link with HIV Community Link. They do have workers out of Medicine Hat as well, and we are branching out into more rural work as well.
Okay, somebody else asks that they noticed that this was being recorded, and if there was any way to access this afterwards. Yes, I will try and get everybody a copy of this, if that's possible, through the emails when you registered. So look forward to that in your inbox. Another question here. Let's see, what can I do personally in my small community to start bringing education to the members? My son passed away here last June. People know our story. I feel it's up to me now to educate. It was in my backyard. And then I'm not sure where to start. And then they add that Delburn, Alberta has a population under 1,000.
Absolutely. I think partnering with organizations such as ours at Turning Point to get involved in events that we do. We're talking about doing some pop-up sites throughout the summer. Any way you can find opportunities to engage people and talk about substance use is a wonderful start. And sharing your truth. I think that's very important, to share our stories and for people to understand that these are real human lives who were loved and missed terribly. We need to start humanizing people that use drugs.